Good evening, everyone. I'm Varsha, your host for today's live all about skin allergy team. I'm sure you're keeping good health. Please vaccinate yourself and wear a mask when in a public space. Today, we are going to discuss about how we can keep our skin healthy with a main focus on urticaria or hives, which we or our near and dear ones would have encountered sometime in their lives. Urticaria is characterized by a round rash on the skin that itch intensely. It may be due to chemicals in certain foods, allergy to certain medications, or there could be certain reasons behind it. 60% of patients are in the age group of 20 to 40 years, and the incidence is higher in the older age group. So, ladies and gentlemen, girls and boys, today we have with us renowned dermatologist of India, Dr. Deepak Jakhar, live from New Delhi, who will educate us more about urticaria and its management. It gives me an immense pleasure to introduce Dr. Deepak Jakhar sir to you all. Dr. Deepak Jakhar is director, co-founder, consultant dermatologist at Dermosphere Clinic, New Delhi. Dr. Deepak has many editorial accolades on his name. He has enormous interest in clinical research and studies. Among many, one is corresponding author of the first published Indian study on dermatological manifestation of COVID-19. Dr. Deepak Jakhar has won multiple awards in national and international conferences. Sir is also known to keep abreast with the latest inventions in medical science so as to offer the patients the right treatment that are of the best quality. Sir, we welcome you in our show. It is a pleasure to have you with us.
Thank you, Varsha, for the kind introduction. And thank you, IPCA, for organizing this informative live webinar on a very important topic, which is urticaria. And as Varsha has correctly mentioned that, many people are known to our dear ones. They, kind of encounter such situation at least once in their lifetime. And it has been found that, up to 9% of the general population actually get urticaria once in a while during their lifetime. So it's a very important topic to start off with. And I also welcome you all. A very good afternoon. In fact, a good evening from my side, because it's now 4 p.m. And I guess we can start, Varsha, with the webinar.
So, sir, our viewers would like to know many things about urticaria and how we can treat it. So let's first start with the meaning of urticaria. What is urticaria basically?
So urticaria is more commonly known as hives in the general population. So these are like mainly red bumps or the red swellings which are appearing suddenly in the skin, sometimes also in the mucosa. And by mucosa I mean the lips, the eyelids, the buccal mucosa, the tongue. So all these swellings can also happen with these urticaria lesions. The characteristic feature with these red bumps is that they appear suddenly. They stays for somewhere around 24 hours, and they also goes off on their own. They are immensely itchy, and if you kind of press these these red bumps with your thumb, you will find that that redness goes away, and as soon as you lift your thumb up, that redness comes back. So that is called as a blanching sign, which is very important in case of an urticarial lesion. Itching is another very common symptom, also in sign, also in these patients, and appearance of these lesions suddenly is again an indicator that you are probably dealing with an urticarial lesion.
Okay, so what would be the different causes behind it? Why does it happen?
So there are many causes by which these urticarial lesions appear. Sometimes the most common one, that is the chronic spontaneous urticaria, is one where we are not able to find any reason for the appearance of these lesions. So they are just appearing spontaneously, and in rest of the cases we do find that there history of either a food allergy or maybe some medicine which is triggering these factors, or maybe even the allergens in the house, like the house dust mites, also can kind of trigger these lesions. And there is also something called as an autoimmune urticaria, where your own blood cells are kind of triggering the release of these factors which are inducing the urticaria.
Okay, so is urticaria or hives really painful?
Not exactly. I mean, urticarial lesions usually are more itchy as compared to the painful. But yes, I mean, sometimes when the patient has the swelling of the lips, or maybe swelling of the eyelids, or maybe swelling inside the mouth, that might cause a bit of discomfort. I won't call it as a pain, but yes, discomfort is the term which ideally is what the patients say with. But the most common symptom is itching in the lesion. So that remains the number one, the symptom which the patient comes with.
Hmm. So we got to know about the symptoms, how we can identify whether we have got urticaria or not. And sir, as you have mentioned that in many of the cases, urticaria will go on its own.
Yes.
So if the person has got urticaria and he's finding the symptoms of it, how he should know that now is the time to go to the concerned doctor and get the treatment for the urticaria?
So if you're getting it like repeatedly, because there's something called as an acute urticaria which appears suddenly, and if it is getting very frequently, so that gives an indication that probably you should get your workup done from a dermatologist, and you should start your treatment accordingly. The second thing is a chronic urticaria, meaning that you're getting these symptoms every day for the past, let's say, 6 weeks. So if it's getting, kind of a chronic kind of a symptom, then again, that gives you the alarm sign that, probably you should go to a dermatologist, get your workup done, and start your treatment. The red flag sign in case of an urticaria, where you should always hurry to a dermatologist or maybe to a hospital or the nearest clinic, is when you're getting swelling of your lips, swelling of your eyelids, swelling inside your mouth, or maybe having a difficulty in the respiratory, you're getting the respiratory symptoms, getting difficulty in the breathing process. So that indicates that, it's a very acute episode, and you should definitely hurry to a dermatologist or maybe to a emergency room in a hospital, because that is something which is a dangerous sign which is associated with urticaria.
Okay, so discussing about the causes behind it once again. So urticaria is genetic or it can occur to anyone?
A very small proportion of these individuals have this genetic predisposition, but majorly it can occur to anyone, because it is kind of a acute reaction to maybe a medicine or maybe a food, something like a seafood, or maybe anything that you are not, maybe like anything like a potato or maybe a fish. So something like that, anything can trigger it. Then also, like, a number of medicines, like even the painkillers that we take for maybe a fever or maybe headache, so that can again trigger. So it is kind of an allergic reaction to the various triggering factors. Another very important factor which comes into play is, your house dust mites. So again, I mean, when you're and one of the symptoms is that, whenever you're going back to your home and you're that is suddenly triggering these episodes, so that gives you a hint that probably there is something in your environment which is triggering these symptoms in you. So all these factors actually have to be taken into account, and more than genetic, I would say that it is kind of a reaction which can happen to any one of us.
Okay, so more of a more for the genetic factor, it is the reaction that we get.
Yes. Yes.
And so suppose the patient has got urticaria and he has waited for a while, but still it's not going, and now he has gone to the dermatologist to take the right treatment. Yeah. So let's discuss about the treatment part first. So what are the possible treatment options available to treat urticaria?
So first of all, the most important aspect of treating an urticarial patient is finding out the etiology. By etiology, I mean what is the triggering factor in that particular patient. Mm-hmm. So we have to take a very detailed history, and the patient should also be aware, of the various triggering factors that might be inducing those episodes. Primarily, a particular kind of food that you are eating on a frequent basis, and that is causing these lesions as soon as you eat the food, or maybe a particular kind of medicine that you're taking, and again after taking the medicine you are getting these lesions. So all these factors have to be, the patient should be aware about all these factors, and these have to be taken into the history and into the account. The second step is to kind of ascertain whether whether this is an acute episode, or maybe the patient is having this urticarial lesions for quite some time. So acute versus the chronic urticaria has to be differentiated right from the beginning. Then, as we have discussed about, the genetic predisposition. So anyone in the family, or maybe towards the paternal or the maternal side, whether they are getting or not. So that becomes important, especially in cases of autoimmune urticaria. So there we have to take all these relevant histories. And after that, also very important factor, as I've been stressing throughout this talk, is, the development of angioedema. That remains very important, because sometimes patients get just, the lesions on the skin and the mucosa is relatively spared. But if you're getting angioedema also, so that means, these are all the alarming signs. So you have to take treatment as soon as possible. After that, the brief history and examination that we have done with the patient. So there is a very limited role of the blood test or maybe the laboratory test that we do for these patients, and these are usually kind of customized, from individual to individual. Usually, we don't do a very comprehensive blood test for these patients. There are certain blood tests, though, that are recommended for these patients, and primarily the acute eosinophilic count, the CBC profile, and also the IgE antibodies. They kind of help you in kind of deciding what would be the course of the treatment in these particular patients. Very rarely we also do, especially in cases where we are suspecting the autoimmune urticaria. So we do the test, which is a skin prick test. It is also called as the autologous serum skin testing test. So that we do in cases of autoimmune urticarias. And then we move ahead with the treatment options. And the most commonly one that we prescribe in our patients are the antihistaminics, preferably the second generation one, because they are less sedating as compared to the first generation antihistaminics. So that is how we start off with the treatment. And for soothing the skin, we can kind of prescribe a moisturizer or maybe a calamine containing lotion. Or, if it is very severe, then a very mild steroid can also help with these patients, topical steroid.
Okay. So you just now mentioned about the test which is conducted to know more about urticaria. So, sir, please could you elaborate about that test?
So that is, apart from the blood test that we have discussed, there is a test called as the ASST. So in that, we take the blood of the patient, we separate out the plasma from that patient, and the serum that we get is kind of injected into the skin, and we see whether the patient is getting any reaction to that particular test or not. So that gives an indication that we are dealing with the autoimmune urticaria or not.
Okay. And sir, is this particular problem urticaria, it is a communicable disease or it does not spread?
It does not spread. I mean, it's a myth in the society that it can, it can be contagious, meaning that, a person by touching other person can probably get it. So that's a myth. It doesn't happen like that. As we have discussed, there are maybe various triggering factors which are actually kind of inducing those urticarial lesions. There is a possibility that, two individuals might be living in a particular environment and both of them are susceptible to that particular allergen. So I mean, you shouldn't take it that way that, I've got it from that particular person. It is the other way around. It's the allergic triggering factor which is causing these lesions in you.
So a very good point we got to know over here, that it is not contagious. It can happen due to some allergic causes and it can happen to anyone. More than the genetic factor, it can occur to anyone. Okay.
Yes.
So coming back to the treatment options. So as you have mentioned that we can apply some ointment and we can treat it in the first phase. So sir, how long does the treatment go if the person wants to get treated for urticaria?
So that's a very interesting and very important question that, patients have to understand that, I mean, there is no set treatment duration for urticaria. The major goal when we treat a patient of urticaria is to limit the appearance of these lesions in those patients. Of course, eliminating the triggering factor remains the number one rule. So whatever is triggering that urticaria has to be eliminated from your diet or maybe from your lifestyle. So if you remove that, half of your problem is gone. After that, when we start with the treatment, usually the goal is to kind of suppress these lesions, and we monitor the patients after we start the treatment, in terms of how many lesions are appearing while the patient is on the treatment. How frequently are you getting all these lesions, whether you are getting angioedema or not, what is the severity of itching when you are getting these lesions. So all these factors have to be taken into account to customize the treatment options. Of course, we have number of the oral and the topical therapies that can be utilized in these patients. But the first step when we take in these patients is starting off with the second generation antihistaminic. And usually the assessment is made at somewhere around 4 weeks, whether that particular antihistaminic is acting in a patient or not. So 4 weeks is the first assessment that we actually conclude that whether this particular treatment is acting in a patient or not, and then accordingly we move ahead with the patient.
Okay, so at least 4 weeks of time, this much of patience the patient should have if they want to get treated for the urticaria. Okay, yes. So sir, even after 4 weeks, if the result is not seen, or even like a mild result can be seen, so what could be the second possible treatment option?
So after 4 weeks, when we see that a particular medicine is not giving a response, so the second step is to increase the dose of that particular medicine. So suppose, let's say you're taking 10 milligrams of levocetirizine in a day. So we increase that dosage to maybe a BD dose or maybe a thrice a day dose. So we again assess in 1 to 4 in the next 1 to 4 weeks how that is responding. So if it is still not responding, and it happens in a number of cases, when the patient is not responding to the first line treatment. So in those particular cases, we switch over to another antihistaminic. So it's a large class of antihistaminic drugs that we have. So we can kind of switch on from one to another one, and we can switch on from second generation antihistaminics to the first generation also, which are slightly more sedating as compared to the second generation's one, but they can be more potent than the second generation in few of the cases.
Okay. So apart from the medical treatment, is there any surgery also done to treat urticaria?
Not as per se. I mean, we don't do surgery for urticaria. It is, it is just identifying the triggering factor and then treating accordingly. So basically, the major challenge with urticaria is that the patients have to understand that it keeps on coming back. So this has to be conveyed to the patient right from the beginning, that there is a possibility that you might encounter these lesions frequently even while on treatment. So that has to be conveyed to the patient very clearly. Second thing is that even after we complete the treatment, and if the triggering factor is not removed from your lifestyle, so that can again cause those reactions again, even after we have completed the treatment. So that has to be conveyed very clearly, and the treatment course will always be a longer one. In most of the cases, I mean, it goes on for months, because that is how we kind of assess, especially in cases of in cases of chronic urticaria, where the patient is experiencing these lesions for months or years to say. So those patients have to understand that it is going to take some time. You have to be patient, and you have to take treatment regularly. You cannot skip the doses. Many patients do it like that. Suppose in a week they get relief with the medicines, then they try to stop the medicines and try to see like how they are responding. So that is not the way to approach the management or the treatment of urticarial lesions. Stick on to what your doctor has prescribed you. He's the best judge when to stop or when to taper the doses of those medicines. So stick on to that. Try to understand how your particular disease is manifesting in your body and how that is going to go away. So that is very important for the patients to understand.
Okay. So a very, very important point we got to know over here, then this is for all the live viewers, as many a times the patient, they get scared when they hear the word surgery or operation or laser treatment. So over here, you don't have to go for any kind of a surgery. The treatment is possible through medication. It's just that you have to keep patience, as sir has just now mentioned. And a very important point once again, that it might reoccur. So you just have to find out the triggering cause behind it, and then you also have to be very much responsible and careful so that you are not getting urticaria again and again. Okay. So, sir, as you mentioned about the medical treatment and like the patient should not skip or stop taking the medicine. So, still, if the treatment is done, they have got to see the result. So, after how much time they should stop taking the medicine?
So again, I mean, there's no, set standards to kind of say that let's skip the treatment after 2 weeks or 4 weeks. That again, depends from case to case, and all the factors that we have just discussed in the history and examination have to be taken into account, like how they are responding. Usually, my approach is to taper down the doses first, and then see how the patient is responding. By tapering, let's say for an example, I would suggest that sometimes a patient might be taking 10 milligrams of levocetirizine or any other antihistaminic for that matter. So it is not a good approach to kind of stop it altogether and see how the patient is responding. We try to taper it down. So let's say from 10 mg we'll go to 5 mg, then we'll go to maybe an alternate day therapy or twice a week therapy. So like that. I mean, you have to give the body also some time to adjust to the various interventions that you are giving in your patients. So there is no set standard as to when it has to be stopped, or when can you check whether your disease has gone or not. So it is majorly I would say that it depends from patient to patient, and you have to take every urticarial patient as a new patient, and you cannot kind of implement one treatment regime for all the patients. So they have to be customized.
Okay. So, sir, what could be the potential complication of urticaria? Suppose if we are not treating it well, or if we are leaving it untreated. So, what can happen?
So angioedema is the most serious complications that we see in urticarial patients. They sometimes come up with the swelling of the lips, and sometimes they are in distress as far as the respiration is concerned. So these are all the serious complications. Sometimes these patients also have GI symptoms. So sometimes the patient might experience loose stools along with the urticarial lesions. So these have to be taken into account, and these are some of the complications which goes beyond skin and the mucosa.
Okay, and sir, many times, as you have mentioned, that the patient will experience itchiness, so they just try to rub their skin harshly. So, what could be the complications behind it if they are doing it very harshly and they are trying to like create problem for themselves?
So, I mean, rubbing it is not going to solve the problem. In fact, it is actually increasing the problem for you because the basic pathogenesis of urticaria is something which gets triggered when you rub or maybe you scratch. So also there is a form of urticaria which is called as dermographism. So you will see that wherever you are scratching your skin, you will find very fine lines along the scratches. So again, I mean, you are kind of inducing urticaria by scratching, and it is not going to give you any relief in those patients. So you have to avoid it.
Okay. So a very important good point that you just have to control yourself from scratching your skin, as it may increase the pain and the complications for you. Okay. And sir, the person has not got urticaria, and he wants to prevent himself from that. So apart from keeping an eye on his diet, what could be the other things he can do to save himself from this particular problem?
Just be alert. I mean, you have to be aware that a medicine or maybe food, anything can trigger these urticarial lesions. So you just have to be aware about, whenever you are getting these lesions, because you cannot predict whether the person is going to get urticaria tomorrow or day after tomorrow or maybe a month after today. So you have to just be aware that various factors can trigger these symptoms. And whenever you are getting these symptoms, just be aware that whatever change that you have experienced. Sometimes patient comes and says, they have had a Chinese food maybe for the first time in their life, and they've experienced these urticarial lesions. So I mean, you have to be aware that that there is something in those food allergens which might be triggering these factors. So you have to avoid them. That is the only precaution that you can take.
Okay. And sir, discussing about urticaria. So, if the person is treating urticaria and he has already got some other skin problem, suppose he has got blemishes or some acne problem, and over it they have got urticaria as well. So, what kind of the treatment is possible to treat both of them without causing any kind of harm to the person?
So both the treatments are going to be different for I mean, for both the etiologies that we are discussing. So let's say a patient is having blemishes and is also having urticarial lesions on the face. So anything which is going to kind of disrupt the skin barrier, like very harsh products like the AHAs and the BHAs that we use in the cream, so they have to be avoided. You have to convey to your dermatologist that once in a while you also get urticaria. Suppose you are going on for a consultation for blemishes, so always inform your dermatologist that you do get urticarial lesions also. So accordingly, your dermatologist will modify your treatment regimes. Anything harsh has to be avoided on the face for all those particular cases, and the moisturization of the face, the soothing lotions have to be kind of incorporated into your treatment plans. And of course, I mean, whenever you get urticaria, you have to kind of switch over to the first line therapies like the antihistaminics.
Okay. And sir, what are the food items that can be included to treat urticaria? Is this possible?
Not as per se. I mean, it is the avoidance of the food that we recommend. Otherwise, I mean, we don't suggest that you can eat this food or that food. So that's not from our side. It is majorly the avoidance of the allergic foods that you are getting those urticarias with. So.
Mhm. So as we say, prevention is better than cure. So it's
Yes.
right to prevent yourself from eating the food which can cause urticaria or which can cause the allergy to you. Okay.
Yes.
So sir, let's take some questions that we have got from our live viewers. So the first one is from Sonia Mukherjee. And sir, she is asking, sir, does urticaria leave any marks or scars?
No, Sonia. I mean, urticaria as per se does not leave any scars or marks. As I've said that, in most of the cases when you get urticaria lesions, they usually settle within the next 24 hours. That is very characteristic of these urticaria lesions. So we don't expect them to leave any scar marks or maybe pigmented spots or maybe, any sort of marks. So they usually leave behind the normal skin as and when they settle.
So this is a point where the patient don't have to worry at all. Unlike pimples or blemishes, they don't. This urticaria won't leave any kind of scar. So it's right
Yeah.
to it's treated at as early as possible. So you won't have to worry about it in future. Okay.
Yeah.
So sir, next question is from Pratiksha Dubey, and she is asking, so which soap is best for treating urticaria?
There is no research for that. I mean, as to what soap is best, but you should avoid any soap which is leaving your skin dry, because dryness as per se can again, kind of trigger those urticarial lesions or maybe increase the severity of the lesions. So you can use any Syndet bar, which is having a pH balance of 5.5 and, which is moisturizing as well. Other than the soap, the best thing is to use a moisturizer as soon as you take bath. So that is something which is going to be very helpful for you if you are experiencing urticarial lesions. You might incorporate something like a calamine lotion or anything there are few formulations which have topical antihistaminics also. So you can incorporate those lotions into your daily regime, especially after taking the bath.
Okay.
So best soap is. I'm sorry, I cannot comment on that.
Okay. So instead of going for a particular soap, it is good to avoid the food items or avoid the factors which are causing urticaria to you. And
Yeah,
all.
and
Yes,
better
sir.
to avoid, as I've said, better to avoid soaps which are very harsh. So I'm not naming those soaps, as you can understand, but it's better to use a Syndet bar or maybe a body wash which has a pH balance as compared to your skin. So somewhere around 5.5 is a good start.
And so nowadays there are many skin items, variety of skin items available that men and especially women they apply on their face.
Yeah.
So that can also be the reasons behind causing urticaria.
That actually is, I mean, the case with many patients, because, with so much of variety of ingredients and so much variety of the products which are available online, especially online, because, I've seen many patients, they buy online products without even consulting a dermatologist. So that is not a very good approach as far as your skin or your face is concerned. Even if you're going for these products, it is always a good idea to kind of test patch these products, because you can just take maybe a drop of those particular products. You can apply it over your forearm or maybe just behind your ear. So just use it like this for a day, and if you're getting any sort of itching or any sort of reaction, so that particular product is not for you. So that is recommended for any new product or any new soap, in fact, that you are using for your lifestyle, any lotion, any topical medicine that you're applying.
Okay. And sir, who are more prone to this particular problem, men or women?
I mean, it is gender neutral, to be very frank. It can happen in men, it can happen in women also. So, I mean, you cannot differentiate it based on that.
Okay. So both have to be really careful and they have to take care of themselves and has to avoid any food items or any reasons that can cause allergy. Okay.
Yeah.
And sir, are children also affected by this particular problem, or it generally occurs in adults or in older people?
Yeah, we see a lot of children also getting urticarial lesions also. And I mean, it is not like, only the adults are getting these. So even the children can be susceptible to various forms of allergens. I have seen, kind of very young children who have started going to the parks and, kind of getting exposed to the plant allergens or to the pollen. So they also usually, kind of get all these skin allergies. Also, sometimes infections, and especially the viral infections in the children, can trigger these urticarial lesions. So we have not discussed about the infection. So that again is a very important factor for the appearance of these urticarial lesions, especially the viral infections.
Okay. As we're discussing about the infection, recently, as we all know that we are affected by COVID-19. So does it have any effect on the skin of the person? Does it cause urticaria?
Yeah, so we have done the one of the first studies from India about the cutaneous manifestations of COVID-19, and we did find out that the patients of COVID-19 were getting these urticarial lesions. So yes, I mean it's a viral infection, we all know now. So as I've discussed, infections can trigger urticarial lesions. So we also find out in our study that patients who are suffering from COVID-19 were having these urticarial lesions or maybe itchiness on their skin. So it can happen.
Okay, so COVID-19 has created a lot of problem and created many other diseases. So one of them is urticaria as well. So the patients
Yes.
who have got COVID-19, the chances are likely there for you to suffer from urticaria. But as sir
Yes.
has mentioned, there is nothing to worry. Through medical treatment, you will get the possible result. Okay.
Yes.
So sir, let's take another question that we have got from our live viewer. And this one is from Ruchi Sharma. And Ruchi is asking, sir, can urticaria affect your internal organs?
So during the acute episodes, as then the two very important internal organs that can manifest symptoms are the respiratory system, and in the respiratory you might experience inflammation. As we have discussed, the lips can get swollen, your throat can get swollen. So you might experience that you are facing some difficulty in the breathing. So number one factor and very important alarming sign is this one. This is one symptom where you have to rush to the emergency as soon as possible. The second internal organ which is usually affected is the GI tract, the gastrointestinal or the stomach tract. So you might experience, kind of diarrheal lesions or maybe abdominal cramps when you're getting these urticarial symptoms. So, I mean, two very important systems is the respiratory and the gastrointestinal tract.
Okay. And so next question is from Shubham Maran. And he's asking, sir, is urticaria a fungal infection?
No, I mean, it's not a fungal infection. Fungal infection is altogether a different entity. It is very much prevalent these days, especially in India and the Indian subcontinent. So do not confuse it with a fungal infection because the management and the treatment for both these entities is entirely different. So if you're thinking that it's a fungal infection, just go to your dermatologist. He will let you know whether it is urticaria or a fungal infection.
Okay. And so the person who is got affected by urticaria and the treatment is going on. So with the ongoing treatment, what are the other things that he need to keep in his mind so that he is not creating any kind of a problem or increasing any kind of a problem for him?
So continuously taking the dosage is very important. I mean, don't skip the dosage, whether you are taking once a day or twice a day or thrice a day. That dosage is very important. That frequency of taking that medicine is very important. So always stick on to that, whatever your dermatologist has prescribed, because I'm sure they have reached to a particular conclusion. Let's say you're taking 10 mg of a particular medicine for thrice a day. So I'm sure the dermatologist must have assessed you and would have found that this particular dosage and this particular frequency is best suited for you. Do not skip and do not try to change that. Let your dermatologist only kind of curate your treatment regime. So that is the only advice from my side to these patients. And of course, avoid the triggering factor.
And sir, is urticaria completely treatable, or in some cases it is left untreated and can cause some other complications for the patient?
Uh, I mean, not as per se. I mean, if you don't treat urticaria, it has been found to affect, your kind of lifestyle or maybe your quality of life. It definitely affects it. There are many various cases where we have found that it is, kind of having a psychological impact on the quality of life of a particular patient because they are getting these episodes very frequently. And there are patients who have been suffering from urticaria for quite some time, maybe some years also. So for those particular patients, I mean, it is advisable that you must follow and you must get yourself worked up and you must follow the treatment regimes prescribed for you by a particular dermatologist. It is not something. You have to understand one thing that it is not something where one particular treatment modality will do the job for all of you. So we might have to shift from one drug to another, and we might have to kind of combine various drugs together to kind of suppress the urticarial lesions that you're getting. So it's a multimodality I would say that it's kind of a a treatment approach where we have to take into account multiple sometimes multiple treatment options to suppress those lesions. So the one thing again as I'm stressing is we have to reach to a conclusion of what particular medicine is acting for you, what is the dose of that particular medicine, and how long do you have to take it. So it sometimes takes some time, and it is it is natural for you to kind of have a certain period where you might experience some of these urticarial lesions on and off while still on medicine. So all these factors are very much natural, and you have to consider all these factors when you're taking your treatment.
Okay. And sir, in rainy season, people experience more of the redness or the harsh spots on their skin. So is it because of the monsoon?
Not primarily monsoon. I mean, what we have seen in the monsoon is that, because the insects increase during the monsoon season. So the insect bite reactions, which can present as urticarial lesions also, is one of the major factors that we see, kind of increase in the number of patients who are experiencing these lesions during the monsoon season. So insect bite is the one that you should consider.
Okay, so in the monsoon, especially because of the insect bite, it might happen. The best thing is go to the nearest dermatologist as soon as possible and take the right treatment on time. And so, as you have mentioned in the beginning, that if you are treating urticaria and you have got the complete 100% treatment, and still the chances are there for this particular problem to reoccur, right? So, what would be the next possible step that the patient can do once the treatment is done? He has got the cure from it. What are the possible things that the patient need to keep in his mind so he can save himself from this problem?
So recurrence in urticaria is a real problem. I mean, you have to understand that even after doing the best, there is always a possibility for these urticarial lesions to reoccur, and one of the primary reason is the triggering factor. So it doesn't mean, like, let's say you have allergy to maybe fish. So if you have eliminated that fish from your diet, you might be allergic to egg as well. So nothing is kind of exclusive that I have eliminated fish, I have taken the medicine, and still I'm getting, or maybe I'm the urticaria is recurred. So you might be allergic to other foods also. You might be allergic to other allergens as well. So that might be causing the second episodes, or maybe like once in a while, sometimes even after taking all the precautions and even after completing the treatment, you might experience these urticarial lesions once in a while. So do not worry about that. Just go to your dermatologist, discuss again, what needs to be done. Of course, the treatment part again has to be restarted if you're getting it very repeatedly. There's something called as an acute intermittent urticaria, where you are just getting these lesions maybe once a week or maybe once a month. So that has to be discussed with the dermatologist, and accordingly your treatment regime has to be modified.
Okay. And so there are few beliefs that the assumptions that people have related to urticaria. So we'll discuss that one by one. And the first one is people say that if they have excessive heat in their body, so then they will get redness or urticaria or hives. So is it true?
Yeah, cholinergic urticaria, or the solar urticaria or the heat urticaria, is actually a type of urticaria. So solar urticaria is when you are exposed to the sunlight for a prolonged duration, or maybe it's excessive heat outside which is triggering, or maybe you are kind of exercising, so that is producing heat inside your body. So that are the possible scenario in cases of urticarial lesions.
Okay. So, sir, in this case, the people who are living in the area which are relatively hot, or the person who are living in south, so are they the ones who are more prone to this particular problem?
No. It's not regional. It is, as I've said, that it can be
Body heat.
triggered even in patients who are living in the cold environment when they are exposed to the sunlight. So it is not related to the geography of a particular region.
Hmm. So yes, the body is experiencing excessive heat, then the chances are there for urticaria to occur.
Yeah.
And so, so, and so second of all, the people who have dry skin, or the people who have oily skin, there are many skin diseases that happens in the people who are having these kind of like skin type, and especially the ones who have sensitive skin. So does skin type also is related to urticaria?
The severity of urticaria is actually related to the skin type. So we have seen people who have very sensitive skin, or people who have very dry skin, or maybe irritated skin, especially people who are, kind of having atopic dermatitis also, which is kind of a skin disease. So all these patients have, increased predisposition to the number of episodes that they might get and the severity of the disease. So both these factors are, kind of correlated with the skin type that these patients have. So dry skin, as I have mentioned previously, also always try to incorporate a moisturizer, especially when you take a bath. So that is going to provide you a good relief, at least in terms of the severity of the urticarial lesions.
Okay. And sir, when it comes to treating urticaria, many people, they try to become doctor of themselves, and they try to do adapt to many home remedies. So people think that if they will put ice on the areas where they have got the redness or urticaria or hives, so then it will go away on its own. So is it advisable to put ice on the areas where they have got urticaria?
We sometimes advise them because it does kind of bring the symptomatic relief, because the itching can get subsided for at least temporarily when you're applying the ice. But very important factor that you need to consider is there is also a variety of urticaria which is called as a cold urticaria. So if you have a predisposition for developing a cold urticaria, that ice cube in turn can actually trigger your urticaria. So again, all these factors have to be taken into account. If you're getting increased itchiness, or maybe increased severity of the urticaria after application of the ice, then you should immediately stop it, because that is a subcategory of urticaria. As I've said, it's called as a cold urticaria. Otherwise, you can apply ice on the lesions, and we have seen patients getting symptomatic relief for that, but it's not the treatment.
Okay. So before taking any home remedy, it is definitely advisable to all the patient that consult a dermatologist, then only take any kind of a step for treating urticaria.
Yes, and majorly, like we have seen all these scenarios in patients, where they don't have access to a dermatologist, because there are many patients who are living in the rural areas or in the peripheral areas where people are not getting access to the dermatologist. Nowadays, online consultations are available. You can get in touch with the dermatologist through the online appointments. You can share your history. You can click pictures of the lesions that you are getting. So it has become kind of an easy. You are always welcome to share your disease with us. We are available online also. So we can discuss in detail. We can have with me or with any dermatologist nearby, you can have a video call or an online call, and you can discuss your disease with them. And you should actually kind of get a proper treatment for your disease rather than relying on the home remedies.
Certainly, as we all know that there are many people who live in the rural areas where they don't have the access to doctors, and especially dermatologists. So we got the solution to that also. You can just upload the picture, or you can take the consultation online and get yourself treated. So it is right that to take the medicine or the ointment which is suggested by the right dermatologist, that is needed. Okay. Yeah. So, sir, another home remedy is people think that if they will apply aloe vera gel, or they'll apply multani mitti, so they can treat urticaria. So, is it advisable?
Again, it is symptomatic relief. Aloe vera, as we know, is a moisturizer. So we have stressed the importance of moisturizer. So it is helping in by kind of repairing the skin barrier. As far as multani mitti is concerned, again, it kind of gives a soothing effect, but it's just a symptomatic relief. It is not actually curing your disease.
Mm-hmm. So instead of getting a temporary relief, it's always advisable to take the right treatment at the right time. And sir, we were discussing about different types of urticaria, as you just now mentioned, that even it can happen if you are applying ice. So what are the different types of urticaria present?
So, one is based on the duration. That is the acute urticaria, which is, you're experiencing daily for maybe something like 6 weeks. And if you're experiencing for more than 6 weeks, it becomes a chronic urticaria. Then there is called as a chronic spontaneous urticaria. Spontaneous means, it is just kind of triggering by itself. There's no etiology as such. There's no triggering factor as such, which is causing these urticarial lesions. And then based on the etiology, you can have a solar urticaria, you can have heat urticaria, cold urticaria, pressure urticaria is also there. Suppose someone is pressing your arm or maybe another part of the body for a long time, you will find that, in that particular lesion, you will get redness and the itchy bumps on those particular areas. Then, as we have discussed, there's dermographism, where when you kind of scratch a particular part of the body, you will find very fine lines on the parts of the body where you have scratched. So that indicates dermographism, and so on, so forth. I mean, autoimmune urticaria, as we have discussed, is another variety where your immune system is actually triggering the release of these, the degranulation of the mast cells, which is actually responsible for causing these urticarias. So there are many types based on the etiology. There are classifications based on the duration of the symptoms that you are getting. So all these things have to be taken into account when you are treating your patients.
Okay. And let's take some more questions from our live viewers. And the next one is from Shruti Nigam. She's asking, sir, can urticaria be caused due to some hormonal changes?
Yes, I mean, there are few papers which suggest that, hormonal changes can increase the severity as well as the frequency of these urticarial lesions. But there is no direct correlation as per se. There are few studies which have correlated urticaria with the thyroid disorders as well. Predominantly, there is anti-TPO antibodies which have been found to be, raised in patients who are getting these urticarial lesions, especially the autoimmune urticarial lesions. So there's no direct correlation, but yes, definitely, I mean, changes in the hormones can increase or decrease your symptoms.
Okay. And sir, as you mentioned that due to pollution, also one person can get urticaria. So it's more like mainly in women, it happens that whenever they go to parlor, they get this advice that because of pollution, they are getting this, or because of the dirt, they are getting urticaria problem, and they are suggested to take the treatment of a facial or of a cleanup. So is it good to get that kind of a treatment?
So if you're getting urticarial lesions from pollution or maybe from the dust mites, so the best approach is to cover your skin, because the facial or maybe a parlor procedure is just going to give you maybe a temporary relief, or maybe even can cause more harms, because sometimes they use very harsh treatments for a particular skin disease. So if you're getting it from the pollution, simple step is to cover yourself up whenever you're going outside. It's always a good approach to apply sunscreen when you're going out in the sun, and not just your face, but also your neck or any other exposed areas have to be covered. So these are the steps which are more beneficial for the patients as compared to the parlor procedures.
Mhm. So very good point we got to know over here, especially for women who are watching this live session, that many a times you will be advised to take these kind of treatment. But as sir has just now mentioned, instead of going for the facials or other treatment in the parlor, it is just to cover yourself so that you can save yourself from the dirt or the exposure or the sun heat. Okay. So, sir, what could be the do's and don'ts for the person who is suffering from urticaria and the treatment is going on for him?
So the do's is follow what your dermatologist has advised you. So that is the number one do's. You have to do that. And don'ts, the number one is try to avoid the triggering factors. Try to identify. Sometimes it is very difficult, 30-40% patients would say that they don't have any triggering factor. So you have to, kind of be certain about this fact that, you don't have any triggering factor. Of course, that's a type of urticaria that we encounter where we are not able to find the etiology, but you have to be aware of all the triggering factors that might be causing that. So try to avoid, that's the don't. And please try to stick to the treatment regimes that, the dermatologists have prescribed to you.
Okay. And so apart from this, the person who has still not got urticaria or is like any of like his friends have not got it till now, and the person is safe till now. So
Yeah.
what could be the skin routine that he or she can follow so he can save himself apart from the food items?
Yeah. So apart from the food items, medicines, and infections, the daily routine for you should include, kind of taking a bath with a Syndet bath or maybe a body wash with a pH balanced soap, applying the moisturizer as soon as you take bath, and using a sunscreen when you go out. And again, in the evening when you are coming back, you have to kind of maybe follow a night regime for yourself, depending on the skin type, of course. I mean, you might use a night cream, maybe an anti-aging cream or a moisturizer. for that purpose. So it's always a good strategy to kind of take care of your skin. Face wash is again one of the most frequently asked question. Patients ask which is to be used. Again, it has to be customized based on your skin type, whatever concerns that you have on your face. So based on that, I mean, there are cleansers, there are AHA, BHA containing face washes, there are like gel-based face washes, forming face washes. So there is a whole range of these products in the market. Don't try to go and buy them by yourself, because not everything is going to suit your skin. So let your dermatologist decide. It's hardly going to take maybe 10 to 15 minutes for you to kind of consult a dermatologist and get those skin regimes done. Nowadays, a lot of people are actually consulting dermatologists for not just the skin diseases, but all these routines, because these are the patients who are actually aware about their skin, and most of them have faced quite some allergic reactions after using the online based product. So don't go for that. It's just going to take maybe 10-15 minutes. Do an online consultation or maybe a physical consultation. Just consult, just tell your concerns. Let the dermatologist decide what kind of skin type you have and what is best suited for you. So he or she will prepare the best skincare regime for you.
Definitely. So there are many beauty items available, cosmetics available in the market, which are very costly and that they can react to your skin. So instead of going for that, you can just go to the dermatologist. Even if you have not got urticaria, you can just go and take the possible treatment or the possible the options available to include in your daily routine so that you can prevent yourself from any such problem. Okay.
Yeah,
So,
and
sir,
in fact, this approach is going to save you a lot of money, because many patients come and they have like bought maybe 1,000 or 1,500 rupees serum or maybe a night cream or something like that, and that has caused reaction on the face or maybe urticarial lesions over the body, and that goes to like waste. I mean, you're not going to use that again. So I mean, that's a wastage of money. You should stop wasting your money. Start to invest in the skin. I mean, that is the best approach. As I've said earlier, something which a dermatologist will recommend would be a more safer approach as far as your skin routine or the skin concerns are concerned.
okay. And so another point is the patient who have taken the medicine or the ointment for treating urticaria, and now they have got rid from that particular problem, but still they tend to use it on a regular basis. And even after the expiry of the product, they think that now it has got expired, so I can even use it for 1 or 2 days, and that can give a rise to some other problems. So what is advisable for the
So
patient?
expired products, don't use it. That is my advice. They are more chances of getting reactions or allergy to your skin with the expired products. Number one. Number two is when you have got rid of your urticaria and if you're still using those lotions or the creams, just try to make sure and consult with your dermatologist whether you can use them or not, because sometimes we prescribe moisturizers. So you can use moisturizers, that's not going to cause any harm. But suppose if you have prescribed some maybe a mild topical steroid or maybe something like a topical calamine. So always consult with your dermatologist whether you can use those particular products for the long-term basis after the settlement of the disease or not. So he will advise you best.
Okay. And sir, it is believed that the urticaria or hives create the problem or itchiness or the pain mainly in night. So is it so?
Uh, in some cases, yes. I mean, especially when the house dust mites or maybe house allergens are implicated for the cause of the urticaria, because as soon as you are going to reach back home, the triggering factor is waiting for you. So that's going to cause the urticaria. Number one. Number two is the increase in the severity of the symptoms. So itchiness, sometimes patient tell that it gets increased at night. And that is one of the reason for that is because your attention is not diverted at night, so you are just focusing maybe on your skin problem or the itchiness. So that kind of gives you a psychological signal that the itchiness is actually increased, which is not the case. I mean, in the daytime you're occupied with your maybe your office work or maybe your homework or any other work that you are doing. So probably, I mean, that particular point of time you are not noticing that itchiness as compared to what you are doing at night.
Okay. So sir, can we consider urticaria or hives as a serious disease?
Only in cases where these are causing fatal signs and symptoms like angioedema or maybe the GI symptoms. Otherwise, if it is limited to the skin, it is very much treatable and very much manageable skin disease. So overall, if you say, then there are certain red flag signs, as we have discussed, that has to be taken into account, and the patient who is getting urticaria should be aware of these red flag signs, because you might get them at any time. So always be aware of these red flag signs. Otherwise, just take the treatment, and I'm sure you are going to be perfectly fine.
And so, as you have mentioned, that the patient who have got thyroid, they are more prone to this particular problem. So, are there any other diseases also which leads to or which can cause urticaria?
I have not said that patients with thyroid have more chances. I've just said that there is some correlation, and they have found that anti-TP antibodies are found to be more in cases of autoimmune urticaria. So as per se, I mean, thyroid patients should not get bothered that they might get increased urticaria. So that is not the case. But yes, I mean, the severity might increase in certain patients. Second thing is, as we have discussed, the autoimmune diseases is something where we have to take into account that they might get increased frequency and increased severity of the urticarias. Otherwise, as per se, I mean, no major correlation is there.
Okay. So this is a good thing actually, that it has no direct correlation. If the person has got thyroid, it doesn't mean that he will get urticaria. There's nothing to worry about it. Okay. And sir, we have discussed that this causes physical pain also. But apart from that, the person who has got urticaria or this skin problem, it tends to decrease the confidence of the person, and they tend to avoid going to public places also. So it is kind of a stress or a torture for a person. So what is the advice to the people who are going through it?
So, I mean, when you're living with urticaria, you have to understand that there are certain signs and symptoms that are part and parcel of the disease, and that is true for all the diseases that anyone is having. I mean, someone might be suffering from increased allergic rhinitis, so he has to be aware that he might get increased frequency of getting sneezes. So same is true with the urticaria also. Just if you're taking your medicine in a proper dose at a proper at an adequate frequency, so there are very less chances that you will experience these urticarial lesions in the public places, or for that matter even at home. So if you're taking the correct treatment, if you have been diagnosed correctly, there is no reason to fear and go out in the public. You can definitely go out and be as confident as anyone else out there. So don't worry about it. But yes, I mean, just be aware of the fact that you have an increased predisposition of developing the particular symptom as compared to rest of the population. So just don't worry about it. It's perfectly manageable disease.
Okay. And sir, people who go for laser treatment for the hair removal, once the treatment is done, like after the treatment is done, they tend to have a red, like rashes all over their body wherever they have got the treatment done. So is it urticaria or just the after effect of the laser treatment?
You can call it as, classify it as urticaria if it is being, kind of getting triggered by the heat of the laser, as we have discussed that there is an entity which is known as like that. Sometimes it's just the follicular prominences, wherever you had hair. So it's just the appearance of these follicular prominences which might get more noticed by the patient after, just as soon as the laser finishes off. So these are all the practical issues that you might face during the laser hair reduction sessions. So again, I mean, these are all manageable situations. Just taking maybe for a day or for maximum for 2 days, an oral antihistaminic or a topical lotion is going to settle them down. So nothing serious about all these issues.
Okay. And sir, in order to conclude this live session, what is the suggestion you would like to give to all our live viewers who are listening to you so patiently and trying to know about urticaria and the possible treatment options?
So try to ascertain that a particular disease that you're facing is urticaria. Your dermatologist will do it for you. Just try to be aware of all the triggering factors. Just be aware that it can be caused by infections, drugs, foods, and maybe house allergens. Even the pollution can cause it. So just be aware of all these factors. Do not try to do your home remedies, especially if you are facing urticaria for quite some time. So you always should consult your dermatologist. always be aware that it is going to take some time for this urticaria to go away. There are various factors which are going to determine how fast you are going to get rid of the disease. And always stick on to the plan that your dermatologist has devised for you. Just have faith in the treatment plan that he or she has advised you, and just follow that. I'm sure you are going to get rid of the urticaria very soon.
So as sir has mentioned, there's nothing to worry about it. It's just that you have to take the right treatment at the right time from the right dermatologist and follow all the steps properly so that you can get rid from urticaria. As there is nothing to worry, the solution is possible for this particular problem. So thank you so much, sir, for such an informative session. It was indeed very, very knowledgeable for all our viewers. They got to know many things about it, and I hope all our viewers have noted all the important points as well. So thank you so much, sir, for your valuable time.
Thank you so much. Thank you for moderating this session, and thank you, Ipka, for organizing this live webinar. Good evening, everyone.
Yes, sir.
Yeah, good evening, everyone, and have a nice day.
And thank you to all our live viewers for being so energetic and asking all the questions related to the skin allergy or urticaria. So we'll see you all soon in the next session. Till then, you can follow us on our FB page. You'll find us by the name of All About Skin Allergy. You can also follow us on YouTube, Twitter, and Instagram, the same name. This is your host, Varsha, signing off. Take care, everyone. And thank you so much, sir, once again for your time.
Thank you, Varsha.